quite a common condition. We have a lot of children who are born with holes in the heart.
Nikajua akona hiyo ugonjwa after 2 months.
Sisi tunaomba hawa homa meshika kama pneumonia. Lakini daktari akiangalia iko sauti sikitu unasema mama.
With time, then they will start to hear murmur over the heart by any doctor going for examination.
Every heartbeat is a miracle, especially when it belongs to a child fighting for a chance at life. In Kenya, thousands of children are born each year with congenital heart defects, often referred to as holes in the heart. For many families, access to this specialized care and costly surgery needed to correct these conditions is out of reach. Without timely intervention, these children face serious health complications, and in many cases, their lives are at risk. In this episode, we take you to the heart of Kenya, where hope and healing come together through the incredible work of the Little Hearts Foundation. We go inside a life-changing heart correction surgery, a complex procedure performed on a young child in urgent need of care. Our cameras followed key moments of the day of the operating room, which offers a rare glimpse into what it takes to save a little life. We also spoke to Dr. Gabala, the lead cardiac surgeon at the hospital, and Dr. Nyawera, a compassionate pediatrician who stands with families through every step of this journey. This episode is a powerful look at how skill, teamwork, and compassion come together to heal one little heart at a time.
My name is Ansala Wangeshi, mother to Adalia Wambui. She is 1 year, 11 months. She has a hole in the heart, which is called VSD.
When Adalia was just 2 months old, her mother sensed that something wasn't quite right.
Adalia was born in 2023 June. Nikajua akona hiyo ugonjwa after 2 months. 2 months nilikuwa nimelazwa hosi like 4 times. So she didn't eat, she was not feeding, she was not doing anything, she was not growing.
I'm Dr. Mohsen Gabala. I'm head of cardiology at MP Shah Hospital. The development of the fetus is very interesting because when the fetus is in the abdomen, he does not breathe like we are breathing at the moment. So he does not use the lung. So the lung is filled with fluid. So that's why he doesn't need to have the part of the heart, the right side, which pumps the blood to the lung.
The fetal heart naturally has small openings that are essential before birth. These help blood bypass the lungs while the baby is still in the womb.
There is holes that God has created, so all the blood does not bypass the lung and it goes to the main body, like in the aorta from the left side. The moment the child is born, that's the moment when you start to cry. That means that he's taking a deep breath to open the lung. Once the lung is open, the hole closes immediately by itself. The rest continue to the adulthood and then they start to have problems. And those are the people that we have to detect on time before they go into heart failure.
How common are heart defects in babies born in Kenya?
It's quite a common condition. We have a lot of children who are born with holes in the heart, but unfortunately, majority of them have late diagnosis. They are diagnosed after their first 1 year of life, so they get to be sorted out or repaired much later in life than they should have.
In the whole population globally, it's about 10% of the newborn, they suffer of some congenital abnormalities. Most of the time, I would say that 70% are holes in the heart. It could be on the fourth chamber level, which is atrial septal defect, or on the chamber, the main chamber level, is called ventricular septal defect. Septal is the in-between wall, and the defect is a hole in the heart.
Studies generally indicate that males are more susceptible to congenital heart defects than females.
Men have XY chromosomes, so the Y chromosome is not neutralized. Women, they have less impact because they can have X and the other X can neutralize both of them. So yes, men are more prone to have congenital abnormalities and to transmit that from themselves to the babies.
Another 11-month-old baby, Munira, was due to undergo surgery on the same day, and we managed to speak to the parents.
Mimi ni Adan Matoye, mimi ni baba ya Munira. Sasa hii vile shida ilianzia kama miezi 3 hivi. Hii mtoto tunapeleka hospitali ya Shello General. Tunapeleka sisi tunaomba homa ameshika kama limonia. Lakini daktari akiangalia iko sauti sikitu unasema mama, tunasikia hiyo. Sasa hiyo daktari amesema ile nurse, daktari ya watoto waangalie hiyo watoto.
Kipata ni homa. Bila shule ni hospitali. Angalia kifua. Nasikia ni sauti.
Sometimes they don't diagnose it on the day that the children were born, but then with time, then they will start to hear murmur over the heart by any doctor going for examination, routine examination, and that will raise a suspicion as well.
While the exact cause for most cases of congenital heart defects remains unknown, a combination of genetic and environmental factors is believed to play a role.
We have several risk factors. We have genetic factors, where you would find in a certain family there are patients where children are born with congenital heart disease. Then we have the environmental factors, which are the major contributors.
Any pregnant woman that smokes or drink alcohol during pregnancy, she has higher tendency to develop the congenital abnormality in the fetus or in the baby. Any drugs in general, they always have what we call teratogenic effect, which is affecting the normal development, especially if it's given in the first trimester, the first 12 weeks. It will affect the heart development of the fetus, and that will lead to congenital abnormalities.
With Adalia's symptoms not improving, Adalia's mom was forced to go to the doctors.
When I went to the hospital, I was admitted for the 5th time. Wakaniambia oxygen iko chini, daktari akaniambia nasikia mama. So I didn't know what's mama. So by then, daktari akaniambia twende tupigwe echo. Akiwa 2 months ndio tulijua kuna shimo 2 kwa roho.
Now, what are the symptoms associated with congenital heart defects?
A lot of the time, the first symptoms is difficulties with feeding. That is, the baby will try and breastfeed, but then they'll take breaks or pauses to breathe. They're breathing fast, they are sweating, and then usually these babies don't gain weight very well. So they gain weight very slowly.
She used to vomit, sweating. She was not growing. She didn't have oxygen.
Some babies turn blue because of lack of oxygen, and the carbon dioxide it increase in the body, the oxygen will decrease, and then they will turn blue. The same like if you turn blue and when it's cold weather in your fingers. But that happens, we call it central cyanosis, which is in the middle, in the lips or in the face. Others can complain of just not growing properly, that every year the child, there is a special rate of growth for the weight and for the height, and they don't meet this curve of normal children.
When she was 5 months, she was 3 kg. You can imagine 5 months with 3 kg.
Then as they grow older, they start developing cough. They cannot play with they can't keep up with their peers. So if their peers are able to play for 1 hour continuously, you'll find maybe a child is playing for 15 minutes, taking a pause, and then, playing again. Yes.
Munira's parents faced a 2-month wait for specialists, perhaps due to the limited availability of specialists in rural Kenya.
Iko siku yake unaandikia sisi. Kama miezi 2 nasema daktari ile kubwa anakuja ya watoto, unakujanga miezi ile fulani. Ngojea, sisi tunangojea. Daktari akakuja, akaangalia. Daktari akaangalia, anasema iko na shida, lakini saa hii bicha hii unapiga hakuna. Lazima tunatuma Meru Town. Tunatuma sisi Meru Town. Baka sisi suku tunaandika suku tarehe 17, alafu sisi tunaendea Meru. Hata Meru mahali nyingine tunakuja tunakosa. Baka sisi tunasema daktari mwingine amekupigia simu, Huko Maua iko daktari ya watoto, tunaenda tupeleka hiyo, alafu daktari akipiga picha kila kitu na picha, yeye anasema shida iko na hiyo shida hii, anasema lazima sisi tunaenda wapi? Kenyatta.
After several hospital admissions, Mama Adalia was eventually referred to Mpisha Hospital for further care.
Adalia came to our heart camp in November of 2023, where she had her first procedure to repair one of the holes in the heart. She was too small to have a full corrective repair, and so she's coming this time now in May 2025 to have a full repair of the hole in her heart, because now she has gained weight, she's grown a bit more, so she'll be more suitable for surgery.
Baby Munira was also referred to the Little Heart Surgery Camp for specialized cardiac care.
Mara tatu hawa wamekuja hii hospitali, naita sisi kama ni Friday ile ukilipita tunakuja hapo. Sasa saa hii iko hapa, hiyo shida iko.
Fetal heart defects are most often diagnosed using a fetal echocardiogram.
Once they are seen by a doctor, they'll be examined, and you can hear some sounds from the heart which we call murmurs, which indicate that there's a hole or there's a defect in the heart. Then after that, they go for a scan called an echo or an echocardiogram, which is an ultrasound of the heart, so that we can identify where the various defects are.
Next, we follow Adalia's journey in theatre. The operating theatre is fully prepared, instruments are sterilized and laid out. Monitoring equipment and the heart-lung machine are tested and ready. The final safety checks are complete and the room is ready for the procedure to begin. Adalia is brought into the operating theatre already under general anesthesia and fully prepped. She is carefully transferred to the operating table. Before the surgery begins, several critical lines and monitoring devices are established. These include intravenous lines for fluids and medications, an arterial line to monitor blood pressure in real time, and a central venous line to assess central pressure and deliver medications. Before the first incision, a special ultrasound and echocardiogram is conducted to get real-time images of the heart. This is usually to reconfirm the diagnosis, assess function, and ensure the surgical plan is still appropriate. An endotracheal tube is inserted through the mouth into the windpipe to deliver oxygen and anesthesia. It is the main airway device and is secured with tape or straps. Adalia's chest and upper body are thoroughly washed and disinfected to maintain a sterile field. This step helps prevent infection during the procedure. Her vital signs, including heart rate, blood pressure, oxygen levels, and temperature, are continuously monitored throughout the surgery to ensure stability. Sterile surgical drapes are placed over Adalia, leaving only the chest area exposed. This creates a controlled sterile field for the procedure. Drapes are handled only by the team members in sterile attire to maintain a sterile environment. A large sterile fenestrated drape, meaning it has a clear pre-cut opening, is placed over the torso. The opening is aligned with the chest area where the incision will be made. The surgical team smooths and secures the drapes in place using sterile adhesive strips or surgical tape. Now only the operative field is exposed, with everything else fully covered. After draping, the surgical team bring in the bypass tubing and prepares the connections needed for the heart-lung machine support, as suction lines are also positioned. The surgeon begins with a midline incision down the chest, typically from just below the collarbone to the upper abdomen, using a scalpel to cut through the skin and subcutaneous tissue. A surgical saw is then used to carefully divide the sternum, the central chest bone. Absorbent gauze is used throughout the procedure to control bleeding, keep the surgical field clear, and protect surrounding tissues. The heart-lung machine temporarily takes over the function of the heart and lungs during surgery. It pumps and oxygenates the blood, allowing the surgeon to operate on a still, bloodless heart. We now leave the operating room as Adalia's surgery continues. Coming up after the break.
So we have a lot of patients that never come to a doctor, even they don't get vaccine because of financial problem, because they are so far.
Lives, yes.
And what is the success rate of the surgery usually?
Okay, it's good. The prognosis is good for most of the surgeries. 98 to 99% there are no complications.
So nikakuja nikasikia our healing hearts wanakuja, na jundi wao tu walimfanyia, nikasema acha kama try nione kama watamselect.
So far, we have explored congenital heart disease, its causes and symptoms. After the break, we speak one-on-one with Dr. Gabala and Dr. Nyawera as we continue to explore congenital heart defects. And now for a short healthcare tip. If your baby shows signs like difficulty feeding, fast breathing, or poor weight gain, don't ignore them. These can be early signs of a congenital heart defect. Early screening and regular checkups can lead to a timely diagnosis and life-saving treatment.
We are living in a lost and broken world, constantly bombarded by messages of hate and atrocities. But with God, we can overcome. Find hope and restoration on the go through life-changing shows on the Family Media app.
And then you will lose yourself and gain the world. And Jesus said, what good is it?
Get to stream Family TV and Family Radio 316 straight from your phone. Catch up on a show you missed or create video streaming playlists by saving and watching videos from our huge variety of shows at your own convenience. Download the Family Media app, available for all Android and iOS users on the Google Play Store and Apple Store respectively. Family Media, keeping Jesus on the airwaves.
Welcome back. Before the break, we got to learn about congenital heart defects, the risk factors and the symptoms. We also saw Adalia go into theatre as the surgeons began to operate on her. Next, we sit down with Dr. Gabala and Dr. Nyawera as we continue to explore this medical condition. The parents of the children with holes in the heart, the babies, does it take a toll on the parents' mental health, perhaps just because of worrying about their children?
Of course, especially if it's the firstborn, because that's your eye stone that you will love all the rest of your life, and especially in the first few months. So once he has a problem, and especially the heart, it scares the parents because they believe that, oh, he's going to die, there's no treatment, I will not be able to finance the treatment. But that's why we have that camp, and the camp, it helped a lot of children across the country.
And once a child is done for surgery or catheterization, does the parent have to sort of treat them, you know how, like, very carefully? The
patient, after, if it's open heart surgery, of course, the recovery time is a little bit longer. It can go up to 5-7 days. But if it is only intervention, which means that without opening the chest wall, the day after they can go home. Most of them, they go home the day after. And of course, the child, if they are older enough to run, will be very careful for the first 2 weeks only, because there is a hole in the artery which was stopped. So not to open again by vigorous activity. So, but after a week, child is back to normal and feeling much, much better.
Do you feel like there's enough awareness as a nation in terms of the medical intervention there is for holes in the heart?
Not enough, because we do our camp within the medical society, so within the doctors, but there are a lot of patients that they have never been with a doctor, so we don't know about them. That's why our statistics in the beginning, when I told you, it is not the same like in Europe. It is less, but because of under reporting that to the medical authorities. So we have a lot of patients that never come to a doctor, even they don't get vaccine because of financial problem, because they are so far. But the government, they are trying now to build a health station in every small community, even at the border with Somalia. I was told that there are even some doctors from Mexico, coming from Cuba, that they are working there. So, and that will even give the word and the marketing to them, just to know that we have a camp, that they don't need to pay money for that, and we can fix any problem in the heart without a big financial issue.
How many of these surgeries have you done so far? Like, when did you start doing it?
Okay, so the team arrived on Wednesday of last week. We did the first case on Thursday. So far we've screened 118 babies or children and young adults with born with congenital heart disease or those with rheumatic heart disease. So far we have operated on 14 children. And then we've had cardiac catheterization cases for which we have done 8 cases so far.
What does cardiac catheterization mean?
It means repairing the defect in the heart without having to open the chest. So they access the heart using the big veins, say, of the thigh or the big veins of the neck.
Sounds complicated.
Yes.
So what happens, for instance, with those children in rural areas or something who the parents never even know what the problem is? What is usually like the prognosis of such children?
It depends on how late they are diagnosed and how severe the heart disease is. So a lot of the time we see children coming when they have progressed too late into their symptoms, or the heart has really been struggling to beat with a problem, like a hole in the heart. So you find the children are very sick, they are very small, but once they get their surgery, they're able to gain back weight, they're able to live good full lives. Yes.
And what is the success rate of the surgery usually?
Okay, it's good. The prognosis is good for most of the surgeries. 98 to 99% there are no complications. In 1 to 2% of the children, we might have some complications arising from either the surgery or from the heart-lung machine. Yes, but so far we've had good success rates. This camp, we've not had any deaths. We've had good outcomes, and we've already discharged the first 7 patients.
Fantastic.
Yes.
So mothers should have hope.
Yes.
Because sometimes mothers get a child and they're told they have a hole in their heart and they panic.
Yes.
Because growing up we were told it sounded very, very serious.
Yes.
But it's good to know that it's something that can be treated.
Yes, it is something that can be treated. And what the charity is doing is building the capacity of the local team, so that now the local team is operating together with the international team, so that we have a continuation of a cardiac center going forward.
As a country, do you think we have enough specialists who can carry out this procedure without input from outside?
Yes, we usually do open heart surgeries, even with the local team. We just need to have more specialists. We have very few, yes. More specialists and more centers, so that people from all over the country can access that care.
And lastly, do these mothers or children face stigma?
Yes, they do. And the children themselves, once they are diagnosed with a hole in the heart, sometimes they're told you have witchcraft or there's something wrong with your side of the family. A lot of them actually are abandoned by the society. For children who are in school, they are discriminated upon, they are bullied, because they need some special care. They can't do all the sports the way they should. They can't do the chores in school. So other children think they are pretending or things like that, yes. So they lose some friends, yeah.
And once they are done for the surgery, do they then just live a normal life like everybody else?
Yes, majority of them, especially once they are operated earlier on in life, they get to live a full life. And when they come back, the next camp after their surgery, and we screen them, and they've gained weight, and they're playing football, and they can keep up with their peers. Yes.
Open heart surgery is common for many pediatric heart repairs, but less invasive options do exist, especially for simpler defects. They are becoming more available with advances in pediatric cardiology.
If it can be fixed from outside without opening the chest wall, yes, we will go ahead and we put a small device to close that hole. If it's not possible, if the congenital abnormalities is a little bit complex, like phallotetralogy, for example, then they have to have an open surgery to correct all the defect.
Preventing congenital heart defects isn't always possible, as many cases are due to genetic factors or unknown causes. However, several preventive steps can reduce the risk of their development during pregnancy.
For the causes that are known, for instance, drugs of abuse, alcohol, and then prescription drugs, it would be good that for women before they get pregnant or before they conceive, they have a chat with their doctor so that we can see if they have any of the risk factors that need to be eliminated. Some of the cases, however, because we don't know the cause, it's hard to prevent. But surely we can do a lot to catch it earlier so that we manage the babies before they become too sick.
I think it will be like a must, even if the children or the newborn comes in contact with any doctor for anything, even if it's like fever or sore throat or any other, or even vaccination, that the doctor has to take the stethoscope and listen to the heart. Because if we listen to the heart and we find the murmur, that will initiate this circle of having echo, and then once they have echo, then they will refer the patient early in the circle before they develop complication. Any drug given to any pregnant woman, she has to raise the question, she has to argue with the doctor if it has any impact on the pregnancy.
In Kenya, heart surgery remains out of reach for many families, even in government hospitals where costs are often subsidized. But the Little Hearts Foundation brings hope where there was none, covering the full cost of surgery and giving children not just medical care, but a real chance at life.
So nikakuja nikasikia our Healing Hearts wanakuja na jundi wao tu walimfanyia, nikasema acha kama try nione kama watamselect. So me nikakuja on Thursday, wakafanya hizo screening, then I went home. Wakanipigia simu wakaniambia nikuje. Yeah. So that was my luck.
Adalia's surgery was successful and she is currently recovering. Munira's story is also one of those many, a reminder that every child deserves a second chance at a healthy life, regardless of where they are born or what their family can afford. A special thanks to the Little Hearts Foundation and their dedicated medical teams who literally travel across the world to restore hope and life to families that had no other means. From the operating room to recovery, it is a story of hope, skill, and compassion. Thank you for watching, and do take care of your health.